Hey guys, Dr. Eric Lindquist on the road again. Theme of the day. When you're choosing to go down the road of clinical sonography, it is a go big or go home discussion. And why is that? You know, the whole adage of, oh, I'm just getting started, I don't want to spend a lot on my machine. You spend what you need to. Because you're not going to see anything, and therefore you're not going to learn anything, and you're not going to go up a curve to be able to see what you're being taught to see. You know, so it's a paradoxical thing. I've been hearing that for my whole career, you know, and it's paradoxical. As somebody who says, I'm just starting out, therefore I just want to get an inexpensive machine, you don't know what you're doing. It's that simple. You don't know what you're doing. You educate yourself first, because clinical sonography is the absolute best skill set you can have as a veterinary sonographer or a veterinarian or a specialist to get the patient where it needs to go when it's done right. You don't want the reputation of just picking up a probe and say, oh yeah, that person's a Yahoo with a probe. You know, you don't want that reputation. Learn rapidly, invest in the equipment that you need to have adequate acoustic penetration, adequate presets, and optimize. So learn how to optimize your image sets first, then move to interpretation. It's a step-by-step process. You can't get off the couch and run a marathon. It doesn't work. And clinical sonography is the same thing. You can't just pick up a probe and start waving it on the animal and expect to know what you're doing. You need the equipment first. You need to spend about $40,000 or more to do it right. That's where the market is, you know, and because a $20,000 machine, $25,000 machine is not going to work in the cranial abdomen of an 80-pound Labrador or 70-pound Labrador or an old dog with thick skin. Those are all things that impede physics, or a tense dog, or, you know, cats, okay, fine, but you're not going to have the resolution to see the subtle changes of pathology or capture those to be able to send to a specialist and specialists to be able to see the pathology. And the reason why I'm talking about this is because I just read, 50 cases this morning before hitting the road, and you know, it's a lot of those are people that we are bringing up through the curve and helping them as we read the telemedicine. We reach out to them, we sidebar with them in order to get the technique refined, that they came to one of our seminars, or they did a live virtual, or they did the STEP Unleashed download and they're working on it and getting them up the curve. We can only get you up the curve as much as the physics are in your favor. And if you spent $20,000-$25,000 on a machine and you're trying to image a 50-60 pound dog, or one that does not have optimized acoustics or has a tense abdomens, by the way, will reduce about 2 to 3 centimeters of penetration of resolution depth, by the way. So sedate. That being said, if you don't have the proper equipment, you're only going to get so far. You're going to miss adrenal glands. You're going to miss cranial abdominal lesions, because that's a deep part of the animal that needs to be imaged. You're going to get acoustic attenuation. So typically $20,000, $25,000 machines, $30,000 machines, you're working in a resolution depth of about 5, maybe 7 centimeters. And you can help that by lowering the frequency of the probe, but that only gets you so far, right? You need the acoustic power behind the lower frequency. Both of those together create acoustic penetration, create optimal resolution in the deep field, you know? And so you look at a cranial abdomen of a beagle, of a 50-pound beagle, an overweight beagle, for example, you're talking about 7, 8, 9 centimeters of depth that you have to penetrate through, right? Or a big Labrador, a 7, 80-pound Labrador, you're looking at 10 to 12 centimeters of depth you need to penetrate through. When you have an acoustic resolution of 5 to 7 centimeters, what happens? You miss that lesion. You miss the lesion. Or you can't tell anything. You expect, okay, I'm in the right position, I'm doing everything right, but you don't have the power behind it. So We can't help you help yourself. So the key point is, you're going to go down this route, spend well, budget well. Come to a course, see if it's for you. Ultrasound isn't for everybody. Clinical sonography isn't for anybody. Isn't for everybody. But when you get a passion for it, have the budget, know how you're going to pay for that 40, know what the monthly is going to be, know how many cases that you need to do to match the monthly, which is essentially 3 to 4 cases in a month. You should be doing that a day. And then budget out accordingly. Plan it. Don't just jump into clinical sonography. That's like getting off the couch after watching a football game and a bag of Doritos and running a marathon. It's not going to work. It's not going to feel good. So plan accordingly to go up the curve. And we will help you and we will get you there. But you need to plan accordingly. Financially, emotionally, intellectually, and train. You should have your hand on that probe every time you're in the clinic, and maybe times that you're not. 5-6 days a week. Scan at least 2 cases a day, 5 to 6 days a week for the next 3 months, and get a rhythm. Sink the hook. And then you will be a rock star. But you need to plan accordingly. So please don't tell me, don't send info at SonoPath.com. I'm just starting to do clinical sonography, and since I'm just starting, I don't want to spend much. Go somewhere else, please. We want you to be serious about what you're doing, because clinical sonography will change your life when it's done right. It will ruin your life and ruin an animal's life when it's not done right. And yes, I'm standing on a pedestal, but I've been doing this for a long time, and I've seen everything. Do it right, go big, or go home. But you go big, we're here for you. And if you go home, you have a friend who wants to go big, we're here for you. We're SonoPath. We're trying to do it right. We're trying to help you do it right. And there's some tough love involved. Go big or go home, guys. It is what it is. Have physics on your side. Have your plan on your side. And go up that curve and change your life for the better. And own a skill set that will make you a better veterinarian. Up, down, right, and left, whatever you do in your career, clinical sonography done right will be nothing but a great asset for the rest of your career. And you'll wonder why you even practiced without it. And we can help you do that. SonoPath.com. We're here for you.